Hello everyone, welcome to today's lecture on prenatal diagnosis, an essential tool in modern medicine that helps us understand and manage the health of a developing fetus. Today we will explore the various techniques used from invasive methods like amniocentesis to non-invasive options like ultrasound scans. Let's dive into the science that works behind the scenes during pregnancy. Prenatal diagnosis refers to the medical testing of a fetus before birth. Why is this important? Because it allows us to detect genetic disorders, structural abnormalities, and other medical conditions at an early stage. This knowledge empowers parents and doctors to make informed decisions, plan for medical interventions, or even prepare for any special care the baby may need after birth. There are two main types of prenatal diagnosis, invasive and non-invasive methods. Invasive methods like amniocentesis, chorionic villi sampling or fetoscopy involve collecting samples directly from the fetus or surrounding tissues, carrying a small risk of miscarriage. On the other hand, non-invasive methods like ultrasound scanning and maternal serum tests simply use imaging or blood tests to gather information without directly touching the fetus. Let's explore each method in detail. First up, amniocentesis. This is an invasive procedure where a small amount of amniotic fluid is drawn using a needle inserted through the mother's abdomen into the uterus. During this procedure, a thin hollow needle is carefully inserted into the amniotic sac through the mother's abdominal wall, guided by ultrasound imaging to avoid any harm to the fetus. A small sample of amniotic fluid, which contains fetal cells and various proteins, is then withdrawn for analysis. Though generally safe, the procedure does carry a small risk of complications, including miscarriage or infection. Therefore, it's often recommended only when there is a clear medical reason, such as advanced maternal age or abnormal screening test results. It's usually performed between 15 to 20 weeks of pregnancy. Why do we do this? The fluid contains fetal cells and proteins that can be analyzed to detect chromosomal abnormalities like Down syndrome and neural tube defects like spina bifida. Although considered safe, it carries a 0.1 to 0.3% risk of miscarriage. In summary, amniocentesis provides vital genetic and developmental information about the fetus, guiding medical decisions and helping expectant parents prepare for the future. Now, chorionic villus sampling or CVS. This test involves collecting a sample of the chorionic villi, tiny finger-like projections from the placenta, usually between 10 to 13 weeks of pregnancy. What is its purpose? CVS helps detect chromosomal abnormalities and genetic disorders like cystic fibrosis or Tay-Sachs disease. It provides earlier results than amniocentesis but has a slightly higher miscarriage risk of about 0.5%. There are two methods to perform CVS, transcervical CVS and transabdominal CVS. In transcervical CVS, a thin flexible catheter is carefully inserted through the cervix and guided to the placenta using ultrasound. Once positioned, a gentle suction is applied to collect a small sample of chorionic villi. This approach is often chosen when the placenta is located in a position that's more accessible from the cervix. Alternatively, if the placenta is located in a less accessible position, the transabdominal method is used. Here, a thin needle is inserted through the mother's abdominal wall and uterus, again guided by ultrasound to reach the placenta and draw a sample of chorionic villi. Both procedures usually take about 20 to 30 minutes and may cause mild cramping or discomfort, but they provide crucial information about the baby's genetic health, helping to diagnose conditions like Down syndrome, cystic fibrosis, and other chromosomal or genetic disorders. Moving on to ultrasound scanning, a non-invasive and widely used method. It uses high-frequency sound waves to create images of the fetus inside the womb. There are two main types, transabdominal and transvaginal scans. Ultrasound helps monitor fetal growth, check the placenta's position, and detect structural abnormalities like heart defects or cleft palate. Since it's safe for both the mother and fetus, it's often used multiple times during pregnancy. Here in this slide, you can see the ultrasound images of embryonic development and abnormalities detected before 11 weeks of gestation. Image A shows a 2D ultrasound of an embryonic spine at 8 weeks. We can observe 3 straight echogenic lines separated by 2 darker hypoechoic lines indicating the normal formation of the spine. Image B represents a 3D ultrasound of an embryo at 9 weeks, highlighting a myelomeningeal, a neural tube defect where the spinal cord bulges through an opening in the spine. Image C shows a postmortem image of a fetus at 10 weeks, clearly displaying open spina bifida, a condition where the spinal column doesn't close completely. Now let's talk about fetoscopy, another invasive technique. Here a thin tube called fetoscope is inserted into the uterus to directly observe the fetus and even collect blood or tissue samples. It's performed between 18 to 26 weeks of pregnancy and is typically used to diagnose congenital disorders or perform surgical interventions in the womb. Due to its higher risk of miscarriage, around 1 to 3%, it's only done when absolutely necessary. Now we see the fetoscopic procedure. First, a local anesthesia is administered to the mother and medication is given to the fetus. A fetoscope is inserted through the mother's abdomen into the amniotic cavity. From there, it's guided into the body of fetus. A catheter preloaded with a balloon is inserted and properly placed. Then the balloon is inflated and then detached. Finally, the fetoscope is carefully withdrawn. Now let's shift to maternal serum screening, a non-invasive method. The maternal serum alpha fetoprotein test, or MSAFP, is a blood test performed between 15 to 20 weeks of pregnancy. It measures the level of alpha fetoprotein or AFP in the mother's blood. So what is AFP? Alpha fetoprotein is a protein produced by the fetal liver and yolk sac during early development. Normally, small amounts of AFP cross the placenta and enters the mother's bloodstream. The MSAFP test checks whether these levels are within the expected range. High AFP levels may suggest neural tube defects such as spina bifida or anencephaly conditions where the brain or spinal cord doesn't form properly. Low AFP levels could be a sign of Down syndrome or other chromosomal abnormalities. It is important to note that abnormal results don't confirm a diagnosis. They simply indicate a potential risk and highlight the need for further testing, such as amniocentesis or detailed ultrasound scans. In summary, the MSAFP test serves as an early screening tool, helping to identify pregnancies that may require closer monitoring or additional investigations. Another blood test is maternal serum Beta-hCG test, which measures the level of human chorionic gonadotropin produced by the placenta. Human chorionic gonadotropin, or hCG, is a hormone produced by the placenta shortly after implantation. The beta subunit of hCG is what pregnancy tests detect in blood or urine. Let's now talk about beta-hCG levels throughout pregnancy. In early pregnancy, beta-hCG levels rise rapidly, doubling approximately every 48 to 72 hours, peaking around 8 to 11 weeks of gestation. After this peak, the levels gradually decline and stabilize for the remainder of the pregnancy. Monitoring beta-hCG is crucial as abnormally low levels may suggest a miscarriage or ectopic pregnancy, while abnormally high levels could indicate a Down syndrome or multiple pregnancies like twins or triplets, or in rare cases, smaller pregnancy. In summary, beta-hCG levels provide valuable insights into the health and progression of a pregnancy, guiding healthcare providers in early prenatal care. Let's summarize. Here is a comparison of prenatal diagnostic methods looking at the timing, purpose, and risk levels. Amniocentesis and CVS are invasive but provide crucial genetic information. Ultrasound and maternal serum tests are non-invasive and help monitor fetal development. Fetoscopy is rare but useful for direct fetal observation and intervention. Understanding these options helps doctors and parents choose the right approach based on medical history and risk factors. Now let's see the ethical aspects of prenatal diagnosis. While these tests offer critical insights, they also raise moral questions. How do we balance medical necessity with the risk of miscarriage? Should a pregnancy be terminated based solely on genetic test results? How do we ensure informed consent so parents understand both the benefits and limitations of these tests? These are complex issues that require sensitivity and compassion. To conclude, prenatal diagnosis is a powerful tool that allows early detection of fetal abnormalities, giving families time to prepare and doctors a chance to intervene. From invasive techniques like amniocentesis and CVS to non-invasive methods like ultrasounds and blood tests, every approach has its purpose and place. As technology advances, these methods are becoming safer and more accurate, offering not just answers but hope. Thank you for your attention. Now I would love to hear your thoughts. What prenatal test would you recommend for a high risk of pregnancy? How do you think we can balance medical advancements with ethical concerns? Let's discuss. Thank you once again.